Welcome back to our channel, where we explore the latest trends and innovations in healthcare design. In today's video, we're going to delve into a topic that is crucial for promoting inclusivity and accessibility in healthcare facilities: hospital design for patients with disabilities. Hi, I'm from Supremedic Consultancy Private Limited, and I'm excited to take you on a virtual tour of hospitals that are leading the way in creating spaces that accommodate the unique needs of individuals with disabilities. Hospital visits can be challenging for individuals with disabilities, but advancements in design are making a significant difference. Today, we'll explore how hospitals are integrating inclusive features, such as accessible entrances, ramps, wide corridors, and spacious elevators, to ensure that everyone can navigate the facilities comfortably and independently. So, whether you are a healthcare professional, a designer, or simply someone interested in creating more inclusive spaces, this video is for you. Join me as we discover the incredible strides hospitals are making in hospital design for patients with disabilities. Don't forget to like and subscribe to our channel to stay updated on the latest trends and innovations in healthcare design. Let's create a more inclusive and accessible world together. Inclusive hospital design is crucial for ensuring that healthcare facilities can be accessed and utilized by people with disabilities. According to the World Health Organization (WHO), over 1 billion people worldwide experience some form of disability, and this population is growing due to factors such as aging and the increased prevalence of chronic conditions. Therefore, hospitals and healthcare providers must ensure that their facilities are designed to accommodate people with disabilities. In this post, we will explore hospital design considerations for patients with disabilities. Accessibility. The first step in designing a hospital that is accessible to people with disabilities is to ensure that the facility is physically accessible. This means that the facility should have ramp access, accessible parking, and clear signage to help patients navigate the hospital. Hospitals should also have elevators with wide doors and large buttons that can be easily accessed by patients using wheelchairs. Medical equipment. Hospitals must also ensure that their medical equipment is accessible to patients with disabilities. This includes equipment such as examination tables, diagnostic machines, and treatment tables. All medical equipment should be designed in a way that allows patients with disabilities to access them safely and comfortably. Bathrooms. Bathrooms in hospitals should be designed to accommodate patients with disabilities. For example, the bathroom stalls should be large enough for a wheelchair to fit comfortably, and there should be grab bars installed for support. Additionally, the sinks should be at an accessible height for patients who use wheelchairs. Visual impairments. For patients with visual impairments, hospital signage should be designed in a way that is easily readable. The font size should be large enough to be read from a distance, and the signage should be placed at eye level for patients in wheelchairs. Hearing impairments. For patients with hearing impairments, hospital staff should be trained to communicate with patients using alternative methods such as written instructions or sign language. Hospitals should also provide assistive listening devices, such as hearing aids or amplifiers, to help patients with hearing impairments communicate with healthcare providers. Patient rooms. Patient rooms should be designed to accommodate patients with disabilities. This includes features such as adjustable beds, lowered light switches, and easily accessible outlets. Hospital staff should also be trained to assist patients with disabilities with tasks such as transferring from the bed to a wheelchair or adjusting the room temperature. Conclusion. Inclusive hospital design is essential for ensuring that healthcare facilities are accessible and safe for patients with disabilities. Hospitals must ensure that their facilities are designed to accommodate people with disabilities, including accessibility features, medical equipment, bathrooms, and patient rooms.